Well, good evening, and thank you for joining. I didn't think I was going to be able to make it tonight. Um, we had a very dear friend in the family that passed away, so I wanted to be with the family tonight, but I'm not. I'm here, but my son and his girlfriend are there, so I'll have to see the family another time, maybe Thursday or Friday. So I want to thank you, Dr. Kim. Dr. Kim is in Louisiana. She's an internal medicine physician, as well as one of our emeralds.
Yes, ma'am, Emerald.
Yes,
Working hard to become a diamond.
that's right, working hard to become a diamond. And so tonight is the doctor's edition. And because the attendance is so low, I thought that since you had so graciously joined me, I thought we'd have a discussion about CBD and about healthcare providers and really why it's important for healthcare providers to understand cannabis and not be afraid of cannabis, and encourage those who are on the line to invite their healthcare professional each and every Tuesday until one Tuesday they make it. Because many of the healthcare professionals are here with Wakana because of their patients or because of their family members who are a part of Wakana and introduce them to Wakana. So, Dr. Kim, I just want you to tell us first how you became a part of Wakana as a physician. I'm sure it wasn't because I spoke to you because I didn't know you, but let them know, how you became part of Wakana, and maybe this would encourage them to talk more to healthcare professionals.
All right, gladly. I was introduced to Wakana products by a patient who came in with high blood pressure, high sugars, and before I could start talking about medication adjustments, she said, hold on, I actually started using some supplements that I think are really working. So as an internist, I do think it's important for doctors to work with their patients because they know their bodies, I know the science. So if we work together as a team, I think patients do a whole lot better. So I gave her 3 months using her supplement, and she came back 3 months later and her blood pressure was beautiful. I mean, not just a little bit better, it was beautiful. But her blood sugar, so for blood sugars, we follow an A1C, and it gives an average of what the blood sugar has been over a 3-month period of time. Her initial blood sugar was almost 13. She dropped down to 9. So this for me was like, okay, I definitely need to be on board with whatever this is. And so we start talking about what the supplement is, and she tells me it's Wakana CBD. And I have to be honest, I told her, no way. There is no way it could possibly be from CBD. But as you say all the time, we never learned about CBD. We only knew this as a drug. That's how we, came up understanding CBD and cannabis. But again, for me, with my patients, we are a team. So I figured if she felt it was working, I needed to figure out why she thought that. And it led me to so much information. All that I learned, it was almost like I felt like a sponge or a newborn all over again, because I was just soaking it all in. But I was fascinated by all of the different articles I found in PubMed concerning CBD and all the different studies that have been done. Animal studies, yes. However, that's how all of our studies pretty much start anyway. But the difference that it's made with blood pressure, blood sugar, anxiety, insomnia. For me, if we can do something naturally, then I'm all on board. And from that point, I actually learn more about Wakana because, of course, I want to have products from a reputable company, and I was blown away. Got myself on her grand opening, and I was ready to start. So got myself involved. But when I got my products in, I did start with myself and my family.
Yeah.
Everything that I've ever done sold in my office, I've always tried it first, or my family's tried it first, because I truly want to be a true testament. I want to be able to give a real life testimony about how it's working. And so my husband, who had been in a horrible crash, had neck surgeries, knee surgeries, was on 4 different pain medicines, and did not like to take them because he didn't like how he felt, but he still had pain. When we got our box in, he put the cream on, and literally he felt the difference in like 5 minutes. And we laugh about it because I looked at a lot of Wakana videos. Everybody who talked about the pain cream kept saying it worked in 15 minutes. It worked in 15 minutes. And I said, surely it could not have worked for everybody in 15 minutes. Well, it did work for my husband in 5 minutes. And he started using the tincture, the gummy, and the pain cream twice a day, every day. And his pain was remarkably better. He hasn't touched any of those pain medicines since. But the surprise was that a few months later, his blood pressure dropped. So I ended up having to take him off of his blood pressure medication, because even though CBD was being used for his pain, because of our endocannabinoid system, he was taking the CBD, but it looked around his body to see where it was needed. The blood vessels evidently was one of those spots. So it's a vasodilator. It opened up the blood vessels and helped his blood pressure. So when we checked it and he said he was dizzy, his systolic was 103.
Wow.
So took him off of his blood pressure medicine. He has not taken it since, and it has been at least 10 months now, probably.
Fantastic.
And he's doing wonderfully well. I've done the same with many patients, Sue. So patients who take it for insomnia, anxiety, many of them end up on a lower dose of blood pressure medicine or off of their blood pressure medicine because their blood pressure is so much better. But it has changed their life for the better, their quality of life.
Yeah.
Not just that the blood pressure is better, but they feel better. They want to do more. They
Right.
want to live now instead of just existing. So
That's
it's been wonderful.
That's incredible. Let's circle back to that patient who first came to you and said, wait, hold on. Was she on any medication at that point?
Yes, she was on medicine already. She was already taking medicine for the blood pressure and for her blood sugar.
Okay. So at that point, she was being faced with, I'm going to give you more medicine.
Yes, or insulin.
Or insulin if this doesn't correct itself.
Yeah. Now, the thing with her is she's actually a nurse practitioner. So she knows better. She knows she could do better, but we as providers live such busy lives that we're taking care of everybody. And sometimes we forget to take care of ourselves. And I really feel like what happened with the Wakana products and her as well is that she felt better too. So she was more active and she was doing more.
Mhm.
So truly changed her way of living. So yeah, she had been on medicine, which, by all rights, probably should have been working better for her if she would have taken the time to do things or taking care of herself first and
Right.
then patients. But the products made her feel better, and it made her want to be more active. It made her want to do more. Yeah, she was living a different kind of life. You could tell just by her whole demeanor how much better she was.
So there are a handful of business partners, distributors on the line. Let's talk about how to approach their healthcare provider.
Okay.
And tell me how you think that a layperson, a patient, should address their physician to let them know, one, I want to take this CBD because I hear Dr. Kim and Dr. Rita and other medical advisory board members talk about all the benefits of CBD. And two, how do you think the best way to encourage them to talk to their healthcare providers about looking at what we're doing here at Wakana? So it's a two-pronged question.
So first and foremost for me, I feel like everybody should have a doctor who they trust, who they can talk to, and who will hear them out. I feel like there are a lot of patients, unfortunately, who put their lives in the hands of people who hardly listen to them. Mm-hmm. And so the first task is make sure you have a doctor who truly is concerned about you and will hear you out. Because, we learn textbook things, but you can't treat a textbook. You have to be able to talk to your patient and hear what is going on with them, because patients know their bodies better than we do. And we have to be able to hear them for what they're saying. I think that it should be a simple thing. I've heard Dr. Kim, I've heard Dr. Rita. I'm really interested in trying this. What do you think? And from that, they ought to be able to look at our videos. I think that we have enough videos out there that they can share where they're hearing from their colleagues about the CBD, and it's not just coming from the patients themselves, but they ought to be willing to just be quite frankly transparent and honest about it. If you've been taking the CBD already and it's working, let them know I've already been using it. Because I've heard people say, well, the doctor said, I can't take it. And you do have doctors who are all out there for themselves, like pain management doctors. Unfortunately, it's a choice between continuing to keep their clinics full versus doing what's right for the patient. And again, patients have to be their own champions, and they have to make sure that they're seeing somebody who cares about them. And if that means having to switch to a different doctor who is going to listen because they care, then your help to me is worth that. Absolutely worth it.
Absolutely.
So I think that first, they should just be transparent. If you're already using products, let them know what you're already using. I still feel like the pain cream is just such an easy shoe in because it's topical and it's gonna work. Right. And so them being able to see the worth of the pain cream from that point, they're gonna be interested. Okay, let me see what else, is there. Giving them the videos will help them to educate themselves, because of course, anybody before 2018 probably has not heard of or has not been taught about CBD. So it's going to be a lot of self teaching going on, but that's not hard because the information is readily available. Absolutely. They just need to push their docs to look at what they're doing and find out why the patient is using it, and look at our videos so they can see the worth of it all. To me, that should be simple.
Yeah, and hopefully that's helpful for all of you on the line, because I get that question a lot, how do I talk to my doctor? And like you said, many patients that I have found are already taking CBD, and they're afraid to tell their physician. But we absolutely want as many of these patients on Wakana's products, because we know our products are tested, our products are safe and effective, and our products work. So let's talk about CBD, cannabidiol. We know that cannabidiol is one of the main constituents from the hemp plant. Now, cannabidiol can also come from marijuana. It can come from hemp, and it can come from marijuana, but just know that our products are sourced from hemp, so they don't give you a high. They don't give you euphoria or paranoia, because hemp is defined as containing 0.3% or less of THC. So that's a huge, huge part of education, because I, as a physician, didn't know about hemp. I knew about hemp seeds and putting them in smoothies, but I never made the correlation that hemp was another species of the cannabis plant, and that hemp could be used as an oil, it can be used as a topical, it can be used as a smokable, it could be used as a spice, it could be used in so many ways without the high.
Exactly. Exactly.
And that's super important. But let's talk about now, Dr. Kim, how does CBD, how does cannabis work in the body? You spoke about the endocannabinoid system. If you could just elaborate on that for our listeners.
Yeah, so everybody, every human being has an endocannabinoid system. And this is it's a series of organs, more than 10 organs. And I think by the end of it all is going to be every organ. But for right now, at least 10 different organs that have receptors for CBD. Our bodies make CBD naturally. We have anandamide and 2-AG. And actually, I read something where they said that 5 different types of cannabinoids had been isolated in the human body.
Yeah.
So those are the 2 that I have the names of. So when you ingest CBD, literally, I look at it, the visual I get is like of Pac-Man, where it's going around the whole body, looking to see where it needs to attach. And that could be in the brain. It could be the heart. It could be the lungs. It could be the blood vessels, kidney, liver. The endocannabinoid system is diffused throughout our bodies. So any way you take CBD, it's going to go throughout the body, see where it's needed, bind there, and give you whatever that symptom relief is. So again, it helped my husband with his pain, but it also found that blood vessel, which was evidently stiff and full of resistance, and caused it to open up and relax, and it helped his blood pressure. People will use it to help them sleep. I've had patients use it for sleep, but it also helped them to feel better, and it helped their anxiety. Or people who are using it for like an energy boost during the day, and they are more creative, and the wheels are turning and they're finishing projects. Multiple medical issues. So to date, for me, I've used it for any inflammatory issue that presents to my patients. Anything my patients are dealing with, I try and see how CBD can be helpful for them. So I've had it help my patients who have multiple sclerosis, blood pressure, of course, insomnia, anxiety. What else? Oh, it's so many things that I can't think. Pain, of course, pain.
Yes, a lot of the GI, reflux
Yeah,
and
yes.
ulcerative colitis and Crohn's and all of that. A lot of our patients have, I noticed, digestive issues and thyroid issues. Those are like 2 of the big ones. And we're really seeing a lot of improvement by utilizing CBD. And of course, recommending lifestyle modifications. We can't stress enough how important it is to reduce stress. We can't stress enough how important it is to forgive others and to let go of resentment. All of those things you're not even thinking about, right, can affect your health, can cause cancer. How? By reducing the immune system's ability to defend itself. So that's what I love about CBD, right? It makes me feel happy. It makes me feel less stress. It helps me to get through the day. And now we know, thank you, Dr. Kim, that it is a science. It's not a snake oil. It's not a magical potion. There's a science behind how CBD works, and it's the endocannabinoid. So tell me how you get your patients started. They come in and this would be a great patient to introduce CBD to because they're interested in alternatives, or I don't know, maybe they have in the past come to you with herbs that they've wanted to use. Where do you get started? Like, do you start with a tincture, a gummy, a topical? How do you choose which products to use first?
So most of the issues that we're dealing with, I very well will suggest the tincture and the gummy. The tincture, once you put the 3 drops under your tongue, let it sit for 2 minutes, it's gonna peak at an hour for sure, and it'll last for about 4 to 6 hours. The gummy is going to peak at 4 hours and last 8 to 12. So that combination from most of the medical issues I deal with, if we do that twice a day, it'll allow them to have as best a continuous steady state as possible for taking care of whatever the symptom is or whatever the medical issue is. If there is an acute something going on, meaning they're having a panic attack, they're having acute pain, they're just stressed, something happened and they're very stressed, then I'll recommend one of the smokables, because that'll just help. Look, it peaks in 1 minute. So that brings in the zen, is what I say. You feel that calm taking over. Anybody that has pain, then I'll also suggest the pain cream. For me, the first thing I ask patients every time I walk in the room is, do you have any pain today? Because I carry that pain cream in my pocket, and I will put it on wherever they are hurting so they can understand just how wonderful these products are. So to have people walk out who need knee replacements and have been using like the compound pharmacy creams, or the diclofenac, or the 2 old goats, to put that cream on and walk out and say, Doc, this can't be real.
Yeah,
This really feels better. So they can tell the phenomenal product that we have. But from that point, they want to get the pain cream, but they also get to see other things that are on the website. And it's also an opportunity for them to start asking questions about, okay, well, but what about this? Well, everybody's grandchild has told them about CBD already.
right.
So now they feel more comfortable talking about it as well. But I'm upfront about it. I've always wanted natural things for my patients. I've been doing natural products as a supplement to the prescriptions for 13 years now. So I definitely will talk to every one of them about it, and then they can make a decision. Some of them still are, oh, but that's not weed. Right. And I have to say, do you really think I'm going to risk my license for weed? And some of them, they want to go and do their own research, which I love because I need them to be informed. But for the most part, I present to them what I feel would be the best options for them. And then they can make a decision on whether they want to try it or not.
Fantastic. How do you deal with the patients that are on 7, 8, 9, 10, 11, 12 medications and they want to use CBD?
So I do tell them to try and make sure that they're taking it at least 2 hours before or 2 hours after their prescription medicines. But I tell them every day, I need them checking their blood pressure and their blood sugar. Mm-hmm. And that way, if their numbers are coming down, we're aware and they have parameters to follow. If your top number gets to 110 or below, you call me immediately so I can let you know how to cut down on your prescription medicine. So I have parameters that I get them to follow, but I tell them to check their numbers every day so that they can be aware. I did tell my husband that as well. He just,
You're right. He was just, I'm dizzy.
I'm dizzy, yeah.
Wow. So let's talk about some of the side effects to CBD. Are there side effects, and how do you deal with those side effects, if any?
So the only time, to be perfectly honest, I've had patients to call me about side effects is when they have not taken it the way I've told them to take it.
Ah,
And so, yeah, especially when it comes to the power gummies and the flight, you start with 1/4. Yes, but
yeah,
I'm a 300-pound male. I don't care. You start with 1/4. And so, or you have the millennials who I've been taking 2 and 3 gummies from the local store. Okay, but it's not high quality, potent Wakana product.
that's
So
right.
start with a fourth. And so what I have seen is somebody not take a fourth, but take a whole, and they'll say they feel like they're having palpitations. Mainly, they just need to go lie down and sleep it off.
Yeah.
But if they take it properly, I have not had anyone take it properly and have a single issue. So I've had people say, oh, so it does get you high. No, because if you take 100 milligrams of Benadryl,
Right.
you are going to be in la la land.
Yeah.
Or with any medicine, if you overdo it, you're going to have an issue because you've overdosed, you've done too much. So it's the same thing with our CBD products, safe and effective. And if you take it properly, you should not have any issues.
That is fantastic. That's such a great example with the Benadryl, right? And that is a question that have been posed to me when someone takes our Delta 8. Delta 8 is another cannabinoid that's a very close cousin of Delta 9.
Mhm.
And very close people to me, my children, taking too much Delta 8 when I told them to start with the quarter.
Mhm.
And it does give you that sort of la la feeling. It's not a high, but taking the prescribed recommended dosing is very, very important. That's why it's just so imperative that we get more healthcare providers on this call so that we can educate, empower, and really lead them to the science, to the data, to the articles, to the PubMed, so that they can do their due diligence and really help a lot of their patients who are looking for alternatives.
Definitely.
So at this time, I'm going to see if there's any questions because we are going to get ready for our 8 o'clock call. Our 8 o'clock call is a business overview. We're going to be going over products and our leadership, our vision and mission statement. Can't talk, a tongue twister there. At 8 o'clock, so I want to leave time. You have 2 medical professionals, licensed physicians on the line right now. So if you have questions, please put it in the chat. If you are a guest, we would love to know that too. We would love to formally welcome all of our guests. If you are a guest, again, connect with the person that invited you so that you can get more information about our 8 o'clock call as well. So let's see if there's any questions, Dr. Kim. And again, thank you. I know you were running from a meeting. You didn't know if I was going to be here, but that is the true blessing on having committed healthcare professionals on our medical advisory board that is, always here to chime in and to empower and to really give us a lot of great information and nuggets that we can take back to our family, our friends, and our physicians, our nurse practitioners, our chiropractors, our dentists, our therapists, our naturopaths, our holistic healers, whatever you're using to address your health and wellness, invite those folks in to this call.
And I would definitely share the flat belly lifestyle video, because there is not a single physician office or provider's office that does not have patients wanting to figure out how they can lose weight.
Absolutely.
And we have a safe and effective way for weight loss and reversal of medical issues that's not going to harm your heart like Adipex can, that's not going to allow you to lose weight right now, only to gain that plus some more pounds later on. This is a true lifestyle modification program that is going to blow people's minds because they are going to feel the difference.
Yeah.
That is the remarkable thing about it. I've lost weight before and gained it back because I didn't feel differently inside. I have lost weight with this program, and now I've transitioned to pescatarian, which I never thought I would do, but I still feel good. And that's what we want. We want people to change their lifestyle, and this is the perfect program for it. So I think doctors' offices need to hear about this.
Yeah, the flat belly lifestyle has been life changing and altering for me. I am a vegan now, and I'm 90% raw, 10% cooked, but the studies, because I'm digging really deep into this vegan lifestyle, the studies that I'm finding is just such alarming how much animal protein is linked to all of these chronic debilitating disease states that we see with our patients.
Yes,
and I'm just so grateful that you're a pescatarian, and I look forward to you joining the vegan lifestyle, because truly, and I just want to be clear, there's so many levels to being a vegan. I'm a natural, raw, healthy vegan. I'm not one of those vegans that eat the processed Beyond Burgers and all of that. Those are processed foods. We really are teaching folks to drink raw juice, to juice every day, to give live food and nutrients to their body. So there's levels to vegan. There are vegans that are eating out there eating French fries and Beyond Burgers. No, we're talking about live nutrients, live fruits and vegetables. And I laugh every time I eat a piece of fruit, because even in medicine, we were taught that fruit is bad. You can't eat fruit. It's too much sugar.
Too much sugar,
right?
Yeah.
Also, we've got to just break that stigma about fruit. Fruit has been given a bad name. So I'm excited about all that we offer here at Wakana, Dr. Kim. I'm so excited that we're able to offer this to not only our friends and family, which we always start with first, and ourselves, but our patients.
Everybody, yes, absolutely. Absolutely.
Yes. Wonderful. Someone just ordered their Omega juicer. You are just going to love it. I have a Nama juicer, but juicing, I juice every single day. I drink 332 ounces. I've graduated to the 32-ounce club, and I eat raw salads, and I'm very creative with things that I'm able to eat and to make now, because I think that's another part of being successful. When you change and modify your lifestyle, you have to cook. You just have to prepare your food. Once you get out of preparing your food, then you start eating poorly. But if you can afford to have someone else prepare your food, you can do that too. But as long as it's prepared and it's live and it's healthy. Yeah. So thank you so much, Dr. Kim. I think I love this format. We can do this format from time to time, where we're doing one-on-one discussions with other medical advisory board members. We'll loop them into this conversation. I want to thank all of our guests, all of our business partners. Please connect with the person that invited you, and God bless all of you. Be well, be safe, and we'll see you next week.
Good night, everybody.
Thank you, Dr. Kim.
Thank you, Dr. Rita.